Dolores Valdez was born in Linares, Nuevo León, Mexico in 1939. She was adopted and married off at 14 years old to Sergio Valdez, so at a very tender age she started a family. She and her husband moved to the United States in 1962. Most of her 11 children were born in the U.S. For work, the family, including the children, went up north and worked as migrant farm workers. When she gave birth to Ernesto, her sixth child, he died a day and a half after his birth. She held him sitting up at the edge of her iron bed for the entire time. She noticed large bruises on her legs. Her seventh birth, with Olga, sadly ended the same way. She too died almost a day after her birth, and again she saw the large mysterious bruises on her lower extremities. She did not think to seek medical attention. Several years later, she began to experience blood vessel eruptions. She remembers working in a cucumber field up north and feeling something wet in her rubber boots. She figured it was from the soggy field. After time passed, she felt so weak she nearly fainted and she called for help. When her boots were removed, they were filled with blood. Dolores was taken to the ER. Back home, she was diagnosed with varicose veins and was told it was because of her upright, stationary position immediately after she gave birth. This has led to a host of problems including poor circulation, chronic pain, inflammation, and fatigue. Dolores also acquired kidney stones in the coming years, but she did not seek medical attention because she had no insurance. When it was no longer bearable, she was introduced to a program for underprivileged minorities who did not yet qualify for Medicare and Medicaid. At Galveston Medical Center, a bag was attached to her lumbar region via a stent directly into the kidney. This would siphon out the kidney stones. She had this blood and urine-filled bag for an entire year. She was relieved when the time came to remove this painful apparatus, but her health problems were only exacerbated by the very surgery that was supposed to help her. She distinctly remembers the young surgeon say, "God damn it." She knew the stent had been broken. He looked around and continued to stitch up the opening. Post-surgery, the pain in the area around the kidney ached, but because she was not yet 65, she again waited. Finally, upon her 65th birthday, she visited a doctor, a specialist who confirmed through x-rays that her kidney was entangled in an artificial. The kidney would have to be removed because it was severely malnourished, deformed, and infection waiting to happen. The doctor showed her and her family her entangled kidney. She lost her kidney. It was at this time that she was diagnosed with diabetes. She states that the doctor or sugar levels peak soon after removal of a kidney and that it would self-regulate with time. Why she refuses to sue when she has evidence to confirm her story, she says, "Porque va mucha gente humilde." By this, she means that a lawsuit might jeopardize the care provided to other people. Dolores, my grandmother, sadly jokes she wishes she had been given a different name.
Identical to the basic pattern, with the variation starting